Again, thank you all for joining us tonight on the virtual town hall. This is April 5th, 2020. So I wanted to start off with this slide here to kick off and share a little bit. And lots of people are sharing their stories on the air and on social media, and there's famous people, actors and athletes and individuals from all corners of the world. You're hearing their stories come out, and it's been amazing to hear. And I want to share my story about this week. A lot of things that I've learned. I learned of the first rheumatologist in Georgia that got COVID. Out of privacy, I can't say too much other than to say that this person has not been practicing recently. So if you're wondering if it's your current rheumatologist, it's not. But unfortunately, this person was not doing very well, is in the intensive care unit at a local hospital and intubated. I just heard a few minutes ago by email, sort of second and third hand. Again, we're limited by patient privacy, but things are looking better. But my understanding is that this person is still intubated. So please lift this rheumatologist up in your prayers. I also learned of my first patient with lupus having confirmed COVID. And this person was hospitalized, but thankfully was recently discharged. So this person's on the mend, and we're all very grateful for that and like to keep them in our prayers as well. And then earlier this week, my son's allergies were acting up, and which was pretty much expected given the really high pollen count. But we quickly realized that there was more to it when he began having a cough and high fevers. The coughs were more than usual, and he was breathing comfortably, thank goodness. But the cough and especially the fever was keeping him from being comfortable, especially at night. And as you can imagine, our thoughts went straight to COVID-19. We kept him in his room. And every time he ventured out, we'd make him wear a mask. But we all knew that if this was COVID, then we in our family were all exposed. This virus is more infectious than the traditional flu, and we've been hearing about all the protections that we need to have just to have a very minimal amount get exposed to us. And here we are living together for days. As all of these symptoms came about. But, more than ourselves, we were worried about him and his fevers. They were over 103 degrees at night, just miserable. And to see, someone that you love suffering like that, it was just horrible. I called Emory's COVID line and was told that we don't qualify to get tested and to isolate ourselves. This issue of testing is really at the heart of so much, and the fact is that there's only a limited supply, like a lot of other things, of materials, and we're just not able to do the testing that we need to do still at this point. And it wasn't very comforting to hear that when you think you have something, you're not able to test for it, and you're left to guess. And so I was reading and rereading the access to scientific literature, and you would think that a physician in the field and access to all these infectious disease specialists would get you somewhere. But the reality is that there's only so much data, and as I've been mentioning to you, it's still ongoing, and not much is going to change in a matter of a few days, and it hasn't. And especially when you're socially isolated, as we all are, you just look for information wherever you can find it. And especially when you have time to yourself, you get kind of sucked into the vastness of the internet. And it's really the not knowing and the unpredictable future that really plays with your mind in these situations. And I'm sure many of you can relate. You think about, when will well, I was thinking about when will my son get better? What will happen if he gets worse? And if this is COVID, what happens to my wife, my daughter, myself? Because there's no question that we would be infected. We don't have symptoms, so are we the ones that are asymptomatic and infectious carriers that people are writing about that seem to be driving a lot of this spread? And if we are, when will we go from feeling fine to feeling sick? What will be the future of our health? This virus is very mysterious in many ways. It's a lot that we do know, but there's a lot more that we don't, unfortunately. And it's very cruel in that when it impacts people, whether you're truly infected or not, when you need the comfort and support of others, uh, you're 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 pulled apart and socially isolated for the sake of the greater good. So you're taken away from a lot of things that potentially could help. And I imagine that a lot of this is not unlike what you all live with, or many of you live with, in terms of lupus, not knowing um, a lot of what can happen from day to day, and there's so many lessons to be learned in many things. But the glass half full part of all of this is that it's drawn me closer to the plight of many of you. I've always told people I never will know what it's like to be you. I try, and I've seen a lot of people living with lupus, but I never will know. But maybe this is one step closer to what you all go through. But I'm fortunate in that I have many friends and colleagues who, despite the distance, have provided words of support and wisdom. I was reminded of others who went through similar events and are now on the mend. And if you're fortunate enough to be someone who has not been directly or indirectly impacted by COVID-19 infection, I hope and pray you never will. But it's only becoming more and more commonplace to share these war stories. And because fortunately, most have a good ending. The front page of the news may often highlight the bad, but for every bad outcome, there are many more good ones. We're now hearing more about the survivors. I have a lupus doctor colleague in Spain who was diagnosed with COVID-19 and is now feeling back to normal. The person with lupus in Georgia that I mentioned is a survivor now in more ways than one. And with each story of survival, we have more hope for a new future. We're also armed with more experience and determination to beat this virus and move forward. And if you find yourself in a dark place, I hope you're reminded of this. You may sometimes be looking only at the tip of the iceberg and missing the large part under the water. As for my son, we got a chest x-ray today, which showed what looks like possibly a bacterial pneumonia, different from what we typically see with COVID, which is a virus, as you know. Though it still could be COVID, we're still learning more about all the different things that it can do, but it wasn't typical. The x-ray, that is, for COVID. And the good thing about a pneumonia that is bacterial and not viral is that you can treat a bacterial pneumonia with antibiotics. I'm not sure if the antibiotics that we did start him on today or time or something else is improving things, but his fever is lower today. And though he's still coughing a lot, and we're hopeful that he's turning the corner. But there's always good to come out of many things, and I hope that you guys can cling on to that as you go through not just COVID, but what you've going through everything else in terms of living with lupus. So the big thing is, again, remains hydroxychloroquine or Plaquenil. Many of you probably have heard about the news conference that President Trump had, I think it was on Friday or Saturday. You can see here in this piece that Trump mentioned lupus patients are less likely to get COVID-19 due to hydroxychloroquine, and that acknowledging, even though there was a lack of evidence, that we should be doing it. So there's some quotes here. They should look at the lupus thing. I don't know what it says. but there's a rumor out there that because it takes care of lupus very effectively, as I understand it, and it's a drug that's used for lupus. So there's a study out there that says people that have lupus haven't been catching this virus. Maybe it's true, maybe it's not. He equivocates a lot, but it really isn't clear, just as the story goes on to say, which study he was referring to. There is no study, to my knowledge, that shows people with lupus are not getting COVID. I started off by mentioning that there was a patient of mine who developed COVID infection, and this person was on Plaquenil around the time of infection. And I think I mentioned in a previous town hall that there are some interesting stories out there. My colleague, who's a lupus expert in South Korea, they have a really amazing healthcare system where they're able to coordinate and get information very quickly. And it's a relatively smaller country, obviously, but he sees a lot of people with lupus at his institution, but he's not aware across all of these data points of anybody with lupus that developed COVID-19 in South Korea. That doesn't mean that there isn't one. And even though they have done a lot of testing, I'm not sure what databases he got that from. So, and I'm sure that President Trump did not hear this particular data, but I'm throwing that out as to bits and pieces that are intriguing that some of us in the field are hearing. Now, having said this, I also mentioned in the previous town hall that my colleague, lupus expert in Italy, has several patients with lupus with a COVID infection. And as to any hints as to what may have helped or hurt, I mean, it's a very small number, but I can tell you that there were both people doing well and people, unfortunately, doing poorly that were on hydroxychloroquine. And they were on a bunch of different background medications, including Benlysta, both doing well and both doing poorly. So there's no clear signal from that small number in Italy. So again, it just points to the fact that there's a lot that we don't know. Clearly, people with lupus, even those on hydroxychloroquine, can get COVID. As to whether hydroxychloroquine makes a difference, I'm not saying that it may not, but it was very premature to have someone like the president refer to the possibility of hydroxychloroquine being helpful in a study suggesting that, because to my knowledge, there isn't any. So again, nothing has dramatically changed in terms of our overall knowledge. That initial small French study that indicated the possibility is there. There's a Chinese study that was a little larger, but still far from perfect, that didn't show a difference. And we're still waiting to see what further and better scientific information comes out. But in this context, what you have is a president referring to these things, and then you have stories like this as well. The Food and Drug Administration, the FDA, approves emergency use of hydroxychloroquine and chloroquine for COVID-19 treatment. And what the heck does all of this mean? Does it work? Does it not work? How do I make of it? Should I be really concerned if I'm running out of it? I mean, that's really boils down to, I think, for a lot of people who are living with lupus, and especially those that are currently on hydroxychloroquine. And this is the way I see it. COVID-19 does not have a cure. And so therefore, there are going to be some that recover, and fortunately, it's the majority. But there are some, and it's a minority, but it's a significant minority, who gets sicker. And a certain percentage of these people will be really sick. And ideally, we would want a drug that's proven, that has gone through all the different steps to get approved by the FDA, but we're just not there yet. And extraordinary times require extraordinary measures. And so we're in a time where that we don't have a proven drug. And so we're left with unproven drugs that show some promise, that have no strong scientific data, but that's all we have. And it is not unreasonable to try these medications if you weigh the risks and benefit, and especially if it's in a compassionate use situation where somebody is really going downhill fast on a ventilator, and you have nothing else in your book, nothing in your book to try. So that's where Plaquenil should remain. And as much as I've been critical about the scientific evidence or the lack thereof that exists, I'm a realist too, but we have to have some sort of formula to look at Plaquenil and decide when and where to use it, and how is that going to dictate the rules around who gets it and how they get it. And so what's coming out now more across the states and becoming more uniform throughout this country is this acknowledgement that the supply is an issue. And I'll talk about this in a minute, how that's changing, but for a while, we clearly are going to have an issue where there's not enough supply for the demand that's out there. And so we have to identify the groups that are the highest priority. And there are many, many people that are not going to fit into these two groups here that I list at the bottom. But hear me now, it's not that you don't deserve hydroxychloroquine. If anything, this whole pandemic and this issue with hydroxychloroquine is showing the issues that have existed all along, that so many people that do deserve this drug, and many others in lupus, by the way, and many more that should be available, are not getting what they need. But going back to hydroxychloroquine in this time, with this supply, the two highest priority groups have to be a smaller number of very, very sick individuals that we need, that we don't really have many other choices, that we need to reserve supply for. And then we have the next larger group of people where they clearly have been taking Plaquenil for an FDA-approved reason and benefiting from it. And that specifically are people with lupus and rheumatoid arthritis who have been taking it and who feel they have been benefiting from it. So everyone else, we just need to figure out how to limit their access for now until we can improve the supply. And so this is the classic supply and demand balance that we have. So what are we doing along the lines of both of these things? Along the lines of supply, we need to increase supply. We need to somehow kind of at least flatten or not increase the demand. So along the supply line, we increase supply by having the companies produce more. And thankfully, a lot of companies have stepped up. And before, it wasn't really clear how they were going to do this, but it's a little bit more clear now. There are a couple companies, well, no, there's one company that actually has a plant in the United States. I think it's around West Virginia or so. They're going to produce hydroxychloroquine. Previously, it was all being done overseas. So it's good that there's a company that's going to start a plant to produce hydroxychloroquine if they haven't been doing already. So that's good. We have other companies that are donating supply throughout the world, but also specifically to the US. And as of last week, it was just more words, and I didn't know exactly the details, but I do know at least for a couple of the companies, the millions of pills that they are going to donate are going to be donated specifically to the US through the national stockpile. And this is various supplies and equipment and drugs that the nation deems important to try not to run out of in emergency situations of war and pandemics like this. And now Plaquenil has been authorized to be a drug that is stockpiled in this national supply. And so, and that's good. So what that does is that it gets into the pipeline, hospitals to have availability and access to hydroxychloroquine for very sick people. And hopefully that will then save the hospitals and other people from dipping into the general supply that is out there for everybody else who's living with lupus and rheumatoid arthritis and benefiting from it. But even with all of this extra pills that are eventually going to come into the supply in this manner, there's still going to be more demand than what is available, at least for a while. And so we have to work on the demand side. And the stockpile is going to be used only for the people in the hospitals. And the FDA, there was you might have heard some stories about the FDA coming out with an emergency use authorization. And a lot of the headlines make it sound like now all of a sudden the FDA made it approved, hydroxychloroquine approved for use in the general public outside of lupus, rheumatoid arthritis, and malaria. But if you read the details of it, the FDA is allowing sick, hospitalized patients to be approved. And basically, that gives them access to this national stockpile that I mentioned. So I don't want you to get the sense that all of a sudden the floodgates are open and everybody's going to get access to that who wants it or thinks that they need it. It would be nice to be in that situation, but all of this is just trying to make sure that the demand is going to the people and the groups that are in the highest priority. Now, this emergency use authorization really is a very small sliver of the demand that needs to be tempered. And really the majority of the demand is going to be in the areas where in the outpatient arena where doctors prescribe and people pick up. And it's these holes that the states and local governments and institutions and pharmacies have been trying to fill the holes of. They've been coming up with their own kind of rules and things like that, especially the very local areas like the pharmacies and the hospitals. Everybody's been kind of on their own trying to figure out how to limit the demand and figure out who deserves to get it. But now we're getting help more at the higher levels. And even though the federal government has been behind a bit in this regard, institutions like the state government and the local governments have been filling the gap. And I just wanted to give a shout out to Representative Kim Schofield and other legislators who helped sponsor this executive rule that the governor signed. And it basically guides the pharmacies as to particular rules that will help to limit the access of hydroxychloroquine to the two main groups that I mentioned, the people that are sick with COVID and the people that have rheumatoid arthritis and lupus that have been known to be benefiting from that before. Just for you all to be aware, and many of you have already, a lot of the pharmacies are now limiting refills to only 14 days, even for the people that have established rheumatoid arthritis or lupus that have been benefiting before. So know that you may have to get refills more frequently, but all of this is designed in the big picture to maintain the supply so that when you do go back in 2 weeks, that there'll be some there. It's much better than just allowing people to get much larger supplies of 90 days. And I know a lot of you have been used to that, and that's been a great thing. But if we do that across the board of all the people who are eligible to do that, we're going to run out of supply and leave a large portion of people without. And so we're trying to evenly distribute across. So thank you, Representative Kim Schofield and others, for at least at the state level to be able to have some kind of common rule where not everybody will be able to interpret things differently. Okay, and again, I apologize, I'm not as prepared for this evening as previous weeks for the reasons that I mentioned in the beginning, but I did get a few questions this week, not as much as before, but that's okay. Whatever we have, and some weeks will be busier than others, but this is what we have, and let's go through them one by one. How do we know if we have contracted the COVID-19 virus with just having a bad flare-up of lupus? Most of us feel this way already. How do we know? I mean, that's the million-dollar question, and we touched on this a little bit last week as well, but I think having also gone through personally what I've gone through this past week, the reality is that COVID-19 has a big spectrum of severity. There are some people that are very mild, as you're hearing, and some people walking around without any symptoms. So there is a possibility that you may just be feeling the way that you normally do, and it's a small possibility, but you may be carrying COVID. There's nothing you can do about that, and you're not feeling any worse for the wear, and you need to be doing what you're already doing, and that's socially isolating, cleaning things regularly, and maintaining things. And you will be fine if you're one of these people that remain asymptomatic, and you may very well be that way. For the people that have a more severe COVID infection, it won't be the symptoms that you're already having as lupus. And so it's not this already feeling that way type of symptom. But if you are having a bad worsening of certain symptoms, what you think may be a flare-up, sometimes it will be tough. But from what I'm hearing, if it's and most of the time when you do have a COVID infection, there's nothing to do other than just time. So if it is a flare-up that is not so severe, you're not sure whether it's COVID or lupus flare, the best thing is to reach out to your doctor, but not to panic. And even if it is, God forbid, a COVID infection that is a mild to moderate increase in some of your symptoms, you're not going to be doing anything differently in general other than to wait. You may, with the coordination of your doctor, adjust some of your medications. There's no hard and steadfast rule. I can't give you something like, if you're on Benlysta, do this or that. We don't know in this regard. And different rheumatologists will have probably different perspectives on that. And they will know you best in terms of your immune condition, what you can tolerate, what you can't. And so it's probably on an individual case-by-case basis that you're going to have to make a decision whether any adjustments need to be made. But at the end of the day, it really most likely is not going to be too many adjustments. If you do have a really bad increase in any symptom, I mean, if it's a severe lupus flare, then that needs to be treated and evaluated. And if it's a bad, I'm sorry, going back to the bad lupus flare, that is something that you need to talk obviously with your physician about. What needs to be done. And the distinction will be, well, I don't want to treat a bad lupus flare if it's a bad COVID infection. And that's the things that your doctor will help you walk through. But you're reading about some of the symptoms that are more common in COVID. And if it's a very, very high fever, unless you have an infection with lupus, like a bacterial infection or something else besides COVID, in the past, I haven't seen fevers as high very often anyway, as high as 103, 104. And from what I'm reading, the really, really high fevers are the ones that are more typical of this COVID virus compared to what I've been experiencing and seeing in my patients with a typical lupus flare. Um, the cough is a significant worsening of the cough. Now, lung involvement that does occur in lupus, and some of you do have a chronic cough, but a severe worsening in a very short period of time, especially in the setting of a fever, probably points to more of an infectious source. And at this day and age, then we obviously want to think more about COVID-19. So that's something that you may want to talk to your doctor more about. The other things that are very interesting is that what you wouldn't see in lupus is this loss of taste and smell that some of you might have been reading about. Again, if it's all by itself, it would be a little unusual for COVID, but if you do start having it, or you might be sensing some of those symptoms, and especially as you start having other symptoms like fevers that are starting to come on, that points more towards COVID-19. You wouldn't have any changes in smell or taste typically with most lupus flares. And then everything else outside of that, diarrhea for COVID, runny nose for COVID, you don't tend to see those things in lupus. And all of your other classic lupus symptoms, especially the skin things, I haven't read much about skin involvement in COVID. So if you do have rashes that are more typical of your lupus, that is something that we have not been seeing in a COVID infection. So I didn't really do a good job in answering that, but I hope over time you're getting a sense of some of these things. And we're learning a lot each and every week and month. Next question. So with so much media and social media, how do we know who and what to trust? There are a lot of sources with doctors are saying and doctors are treating COVID-19 with. I need reliable sources. You're right. Even what are generally reliable news sources can quote other people, and with information going so quickly, it comes across maybe not as accurately as in retrospect it should have been. And to go to the source, I think there's very few that I would go to, but frankly they're boring to read sometimes. If you go to the WHO, if you go to the CDC, everybody talks about them. The state public health websites, the Department of Public Health, you can and should still go there first and see what's being updated. And it looks like what you've been reading in the news all the time. But that information is what people have really thought very carefully about as to how it's worded, making sure that it doesn't suggest something that it shouldn't. So that's where you should start. And then we all need more than that. You want to know what's changing, what's new. And so you have to depend on the news. And you will get a lot of things like doctors are saying. And it's really hard to know sometimes what those sources are. And you have the president mentioning studies of lupus that we in the lupus field, the researchers, have never even heard about. So it is difficult. And I don't have a strong sense as to how to filter that very well in a general sense, other than to say, be cautious. And when you do have news that comes out, go to the sites that you trust. And I also include the Lupus Foundation of America. They have a great resource, both at the state level, and our state chapter level, and the national level. And if it is a big enough story where, let's say, we do find some positive results for hydroxychloroquine, you will see that repeated on the trusted websites. So if it sounds too good to be true, maybe it is. Don't overreact on it. Definitely look for other sources to pick up on it. Go back to the trusted sources, because they will comment on the news that really does matter to you. It may be a day or so late, but they will. And we're a community. Please send me whatever questions or things that you are seeing in the media, and I'll pull in all my other sources, and maybe as a community we can really help vet together how trustworthy these news pieces are. Okay, so we can walk together as a family and try to wade through these waters. So next question, have any lupus patients tested positive for COVID? And I mentioned that earlier. We are getting cases here, and there are cases internationally. We need to learn more about what that means for people with lupus. Are homemade fabric masks better than nothing at all? So the masks, you've been hearing more about in the news, and I believe the general recommendation now is for people to wear masks in public, I think. And the concept behind the mask is for other people to be protected from you. And I think most people get the impression that the mask is for protection for yourself. And that really isn't true. It's really that if someone is asymptomatic or without symptoms and they don't know they have a COVID infection, but they do, and they're talking, they're maybe even coughing unwittingly, that mask will keep it from the particles from being sprayed onto the things around or the people that may be around. So any barrier that will help protect that is good. So cloth is not the best, but it's because we have a shortage on the medical grade masks that have to be protected for the people that need it the most. The cloth masks are better than nothing. And there's no guidance that I'm aware of as to what type of cloth, what mesh, how dense it is, but the denser the better, but it really is for other people to be protected from you. And the struggle that a lot of public health people had in this mask recommendation is that having a mask or something to cover your face, whether it's a bandana or a scarf, it will increase the chance that people will touch their face as the mask moves around or the scarf moves around. And so that's been the challenge. But the US public health community is getting more data from other countries, especially the Asian countries where they have implemented these masks more. And it does seem to have made a difference. It was about, I think, roughly around 20% reduction in the transmission rate, which is not as good as 80%, but 20% when you're talking these large numbers is a big deal. And remember, a couple weeks ago, I gave you that picture of one person transmitting it to 2.5 people, and then next thing you know, in a month, it's over 300 people that get infected. So any sort of reduction does down the road make a huge difference. So remember that, wear something comfortable, find any kind of mask. It's to really prevent your stuff from going around and hitting other people. But to a certain degree, it will protect you if someone were not masked, did by mistake sneeze or something or cough around you. Some of those particles hopefully would land on your mask and not get into your lungs. So there is some element of protection, but it's really more for other people to be protected from you. Hope that made some sense. And along these lines, this last question, so the governor opened up the beaches and some parks to be open. So is it safe to go to the beach and to the parks? There's nothing safe or unsafe about any place in and of itself. A church is neither safe nor unsafe. A beach is neither safe nor unsafe. It's the people who are infected, and whether they know it or not, that are safe and unsafe. So it's what these particular locations do to increase the chance that people interact with others. And so a beach may be big and wide open, but it's an area to congregate, and people have to get to the beach probably through certain walkways. And we all try to be careful, right? But there are always people around the world that are not as careful, or they may make a mistake. And so as careful as you are, it may not make a difference if you're sitting on your beach blanket and someone sneezes upwind from you, or walks too close to you, or they're they're not paying attention. And so when you have larger numbers of people that congregate in a beach, and it's an entertainment area, you're bound to have mistakes. You're bound to have some people who just are not educated, who are totally reckless or careless, and all it takes is one, right? And so that's what's really frustrating about this order for a lot of people, including myself, is that, granted, we all are getting stir crazy in our house, but with the surge not even yet been completed in Georgia, it's this type of area that really entertains the possibility of mistakes happening and transmissions continuing to occur. So keep that in mind. It's legal now, obviously, and I wouldn't judge any of you if you wanted to go to a beach, but just know that that's the risk. It's not that you would be careful. I know everybody here, just by the definition of being educated, having lived with lupus, or caring for someone with lupus, you all are attuned to it more than the average person probably. But it's the other people that I worry about. Okay, so I've gone over my usual 30 minutes as usual, but I just want to finish. Those are the questions that came in as of today at noon. Just want to remind you about the Lupus Foundation website. The resource for COVID is there. Check it out on a regular basis. New things are being added all the time. Terry's doing a great job with that. Just a reminder, we need to learn more about this. I mentioned to you all last week about having a registry of people that have lupus that are positive for COVID. We are setting something up locally through Emory's research review process. We're going to do it in a way that protects people's privacy. We want to do it well. So we need a little bit more time to set that up. So be on the lookout for that. Research is happening all throughout the world, and I know we're going to make a big difference soon, and that includes with your effort. So we're all in it together. And be reminded that you can send your questions to info@lfaga.org by noon of the Sunday every week. And I will be here with you all until this blows over or you guys don't need me anymore. And I hope and I pray that happens sooner rather than later. And I'll circle back to how I started off with this. And this week just reminded me of how very scary and anxious all this can be, and how the social isolation is good for the public health, but it can play some games with you. And hang in there. And it can be tough. Just know that the perspective changes when you're around other people, communicating virtually, of course, communicating with them. When the sun comes up, just take a deep breath. Things are not always as bad as they may originally seem. We're in it together, and there's a lot of crazy information out there that can stir some emotions, and people can get desperate in pandemics, and I understand that. But let's get through this together. Let's help each other have the best information, the most accurate information, and let's keep calm and make sure that lupus doesn't get us down. Okay. Well, thank you all for your kind words on the chat. I don't really have time to look at them that often as I talk. I'll keep you guys in my thoughts and my prayers throughout the week, and I look forward to talking to you again next weekend. Have a great week.